Hi, I'm Jessica Myers. I'm going to do a chest and extremities assessment video. I'm now going to scan the room to prove that I'm not using note cards or cheating in any form. Alright, for the purpose of this video, my patient is already disrobed and in minimal clothing. In any other setting, they would normally be given a gown. I would first check the chart to gather necessary information. Next, I would provide patient privacy. In this setting, it's a closed door. In others, it would be a pulled curtain. I would then wash my hands or use sanitizer, depending on what is available. And then I would introduce myself and the assessment would begin. Hi, I'm Jessica Myers. I'm the student nurse today. Can I have your name and date of birth?
Henry Weber, 198.
Alright, and as she's stating that, I would confirm with her armband for the two identifiers. Alright, what brings you in today?
Just a checkup.
Alright, a checkup. Are you in any pain right now?
No.
No. Alright, so I'm going to do a couple of tests and ask you questions along the way, okay?
Okay.
Alright. Do you have any neck pain? Any rigidness?
No.
Alright, I'm going to have you go ahead and lie back. And as she lies back, I'm going to check for jugular distension. And as of right now, she does not have any. It is normal on both sides. I'm going to lift her to a 45-degree angle. Yep. In other settings, you would lift the bed. And this one, I don't have a bed that lifts, so I have to assist in that. I apologize. And at this angle, she does not have any jugular distension as well. Alright, so next I'm going to palpate your carotid on each side. You want to make sure that you do not do both sides at the same time or else you can make your patient pass out. I'm going to go ahead and do that. Alright, the carotid is equal bilaterally, +2. And next, I'm going to check for bruits. So what I'm going to have you do is inhale, exhale, and then hold with each place that I put. I'm going to put it at your jawline, midline, and at the base of the neck, okay?
Okay.
And I'm going to use the bell of my stethoscope. Alright, inhale for me, exhale. Alright, you can go ahead and breathe. Then anytime you need to breathe, just let me know.
Okay.
That's crucial so the patient also does not pass out because of not breathing. Alright, breathe in for me. Breathe out. And then hold it. Alright. There are no bruits noted. Okay, I'm going to move on to the anterior chest now. I'm going to ask you a couple more questions about that, if that's okay. Alright, do you have any pain or tenderness that you know of?
No.
Okay, any injuries to your chest
No.
or your back?
No.
Alright, do you smoke?
No.
No? Okay. First, I'm going to inspect the skin, which is of normal color for ethnicity. There are no contusions, lesions, abrasions. There's no macules, papules, nodules that I can see. The temperature is warm, the skin is dry, so there's no issues there. Alright, next I'm going to palpate some areas. Alright, so just let me know if there's any tenderness or pain. Okay? And as I'm doing this, I'm noting the patient's facial expressions is relaxed and not grimacing, which can also be a sign of pain, even if they do not say that there's pain. Alright. Next, I'm going to palpate the lung fields in the front. So you start at the apices of the lung, which is above the clavicle. Alright. And then next you would find the sternal notch. Go down to the angle of Louis and go to the second intercostal space. And then when you percuss, you want to do it in between the ribs due to that being over lung tissue rather than over bone. So find that, go to that intercostal. And then you want to do a zigzag pattern, so you're making sure that you are checking on each side in both lung fields. Sorry. One thing to note is with each patient, there is a different amount of checkpoints that you would do, because you wouldn't do the same amount of points on a smaller adult versus a larger adult, or same thing for a child. So it really depends. As long as you are ensuring that you get the entire lung field, then you're good to go. Next, I'm going to auscultate for lung sounds, which would be the same areas that I palpated and percussed. And you make sure that you switch to the diaphragm for this. It wants to go. I'm just going to have you breathe in and then breathe out, normal breath. One more. Sorry, gotta reach up on there. Alright. For that auscultation, the lung fields were clear. There was no wheals, rhonchi, wheezing, and the flow sounded really good. Next, I'm going to auscultate the heart sounds using 8-to-man method. So you would first locate the aortic, which is the A in 8-to-man. You go down to the second intercostal, right sternal border. Alright, then you would go to the pulmonic, which is the second intercostal, left sternal border. Then you'd go down to the third, you'd have to displace that, go down to the third intercostal space, left sternal border for Erb's point, which is the E. Then you would go under to the fifth intercostal space to find the tricuspid. And then the fifth intercostal space, mid-clavicular line. So you would find that and go down to the fifth. Alright, S1 and S2 are present, regular rate and rhythm. And as you're doing this, you also assess for the PMI. There is no pulsations or any of that. The area seems normal, so that's good. Looking at the diameter of the chest as you were doing this, the chest wall is normal. There is no barreling or concaveness of the chest. Okay, we're gonna go ahead and move to the back, so I'm gonna scoot you this way. Okay. For the skin assessment on the back, I noticed that there's a few abrasions. So it looks like there's a little scratches. There is a pretty large birthmark on the left area of the scapula. Other than that, the skin is of a normal color for ethnicity. Once again, warm, dry, and then no other issues noted. Okay, next I'm going to palpate the area again. So once again, if there's any tenderness or pain, please let me know, okay?
Okay.
Alright, start here. Alright, any tenderness or pain?
No.
Okay. So after that, I would start percussions. So once again, you would start up higher to the apices of the lungs. You once again want to follow that in between the intercostals. But you also want to make sure that you are going in between the spine and the scapula so you're not hitting bone and you're getting that lung tissue. You also want to make sure that you are checking the lateral sides of the lungs. Sorry, I'm going to just reach over here. Alright. On both percussions, the sound was resonant and appropriate for the lung fields. There was no abnormalities. Next, I'm going to auscultate the areas. I'm just going to have you breathe in, then breathe out once again, okay?
Okay.
Alright, breathe in. Again. If at any time you need to stop, just let me know. Gonna reach under here. And while doing this, you need to make sure that you're listening to the full respiration, because most of the time with wheezes or anything, that's at the very end of the expiration, so most do not hear it. So just make sure you listen to the whole cycle itself. Alright, so lung fields are clear. I'm going to do a couple tests, alright?
Okay.
Okay. So for this, I'm going to do test for the tactile firmness. So what I'm going to do is I'm going to locate C7, which is the notch right here, and place my hands here. I'm going to have you say 99 for me, okay?
99.
Alright. And once again.
99.
And again.
99.
Alright. The vibrations dulled as they went down, which is a normal finding, which is also good. Alright, I'm going to check for the symmetrical expansion of your back. So you find T10 by locating the bottom of the scapula and going 3 down, so about right here. I'm going to pinch the skin, have you breathe in and out. Alright, in and out. Alright. The expansion was symmetrical. There was no further expansion on each side, so that is a good sign as well. I did not feel any crepitus when I was palpating the back as well. Okay, so next I'm going to check your extremities. So looking at the arms, feeling the arms, they're warm, dry, no lesions, abrasions. Once again, hair is equally distributed, and there are a few small novi that are less than 1 centimeter, but other than that, we're good. So right now I'm going to feel for your brachials, okay? If at any time you need me to stop, just let me know.
Okay.
Alright. The brachials are equal bilaterally plus 2. The next feel for your radials. Pulse. Okay. Alright, equal bilaterally plus 2. Do you have any numbness or tingling in your arms?
No.
Have you had any injuries to your arms
No.
at all? Okay. Alright, I'm going to try one more thing. I'm going to do capillary refill. It's where you pinch this 3 fingers. Alright. Okay, capillary refills on the hands is less than 3 seconds, which is what we look for. So that's good. Alright, I'm going to have you lay down one more time. I apologize.
You're alright.
Okay. So for this assessment, I am going to look at the skin. And there is an abrasion on the skin. Hair is equally distributed. Apologize. The skin color is of normal for her ethnicity. Temperature is warm, how it's supposed to be. So that is good. Alright. So for these, I'm going to feel for the popliteal folds. Alright, just bend your knees a little bit for me. Thank you. This might be uncomfortable, so if you need me to stop, let me know.
Okay.
These are a bit harder to find, but it might take a second. Alright, those are equal bilaterally plus 2. Next we go to the posterior tibial. And as you're doing this, you do both at the same time so you can compare. Alright, those are equal bilaterally plus 2. Then you find the dorsalis pedis. Sorry. Alright, that is equal bilaterally plus 2. And then you will also do a capillary refill on the toes. Alright, capillary refill is less than 3 seconds, which is good. Since you're laying down, I'm going to test the strength in your hands and feet real quick, okay?
Okay.
So I need you to pull my fingers. Alright. I need you to push against my hands. Alright, and then pull. Okay, strength is good. There's no lag or any issues with that. I'm going to have you do the same thing with your feet. I need you to push against my hands. Alright, pull. And then I need you to lift this leg up for me. Okay. And put it down. Lift this leg for me. Alright. Then you can relax it. There was no issues with the push-pull with either hands or legs or feet. The legs lifted and there was no strain on the back or any shaking of the legs, which shows that there's no issues with that area. All right, I'm gonna set you up. Do you have any other questions for me?
No.
All right, I'm gonna go put this stuff in the chart and then someone will be in to see you shortly, okay?
Okay, thank you.
All right, thank you.